Hello, everybody, and thank you for joining today. We're just going to give people a few minutes to join. Great. So, thank you all again for joining us today. Today, we will be covering WACARE's assessments. My name is Sam, and I am the WACARE's Fund Communications and Marketing Manager. I will be hosting today's presentation, and let's take a minute to meet the panel. Sebastian?
Good morning, everyone. Thank you for joining. My name is Sebastian Kahe. I am the Outreach and Language Access Lead for WalkCares.
Maria?
Hey everyone, my name is Maria Mungarro. I use she, her, ella pronouns. And I am the eligibility program manager here at DSHS. Well cares. Thank you so much.
Yeah.
Hello everyone, my name is Sun Young Park. I use she, her pronouns. I'm the Benefit Eligibility Program Manager at WellCare Fund, and I serve as the product specialist for Get Care, our assessment tool for determining functional eligibility. Thank you.
And Jesse?
Hello, I'm Jesse Rangel, Regional Administrator for Region 1, and I work out of the Yakima office. Nice to be here.
And Tina?
Good morning. My name is Tina Lay, Region 2 Regional Administrator, and we are responsible for regional operation.
And
Thank
Terry?
you.
Good morning, everyone. Terry Redmond, Regional Administrator in Region 3.
Great. We do have some other WalkHere's team members who will be answering questions in the Q&A function during the presentation. Anyone who has joined us using a computer or through the Zoom app on their phones can submit questions through the Q&A function at any point during the presentation. If we're unable to get to your question during the allotted amount of time, you can email us your question by submitting it through the contact form on the website. This webinar will be recorded. The recording, along with the slides, are available on our website. The slides are already posted, and the recording will be available within 24 hours of the completion of this presentation. And now I will pass it to Sebastian.
Awesome. Thank you, Sam. And thanks again, everyone, for joining us this morning. Before I jump into the slides, I do like to get a sense of how familiar we are all with the program. So again, if you have heard of the Walk Cares Fund before or know some information about it, a little bit about how it works, if you could maybe share some sort of emoji, whether it be a thumbs up, a heart, again, just to get a sense of how familiar we are with the program already. Awesome. I'm seeing quite a few thumbs up and hearts, so that's great. Of course, we have a spotlight on the assessment, so that's hopefully going to be some great new information for y'all. So let's get started with a little background information around long-term care. A program like Walk Cares is needed because the way we have paid for long-term care up until now isn't working. So even though 70% of us will need long-term care at some point in our lives, most of us really can't afford it. We can see there that the cost of 20 hours of home care per week is just over $23,000 for 6 months, and other types of long-term care are more expensive. If we compare that to the median household income for Washington seniors, just below that at $69,000 per year, right? That's a big chunk of a household income. And to fill that gap, oftentimes we see family caregivers step in, and that can be either with their own savings or by providing some unpaid care as well. That, of course, has some pretty big impacts as we can see on the caregivers, right? So almost half report a related financial setback, and spend on average 25% of their own income on care expenses. Many also have to leave the workforce early to be able to provide that care. And we know that caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits. This also impacts our businesses, right, and our economy more generally. So most caregivers work full time, and 61% of working caregivers say that it has impacted that their care responsibilities has impacted their job in some way. So that can be maybe having to come in late or leave early more often, reducing the amount of hours, maybe going part-time, or even quitting, right, or retiring early. And when a working caregiver leaves their job, it can cost 1.5 times their salary to replace them. So how the program works, how the Walk Cares Fund works, to earn benefits, you automatically contribute 0.58% of your paycheck during your working years, and you only contribute while you're working. So when you retire, or if you become unemployed, contributions stop. And everyone is covered at the same low rate regardless of pre-existing conditions. So starting in May of 2026, next year, folks will be able to apply for benefits. You'll need to meet a contribution requirement and a care needs requirement, which we'll be talking about here throughout the presentation. Once you're approved, you can choose how you want to use your $36,500 benefit. It is a lifetime benefit that grows with inflation each year. And you will be able to choose any covered services that you want, which we will also talk about later on in the presentation. There are also no out-of-pocket costs when you need care. We pay the providers directly for the services that you receive with no copay or deductible. So I mentioned the contribution requirement. That's what we'll talk about here next. So everyone who is contributing to the Walk Cares Fund more than 500 hours per calendar year is earning benefits, and that includes part-time and temporary workers. So to qualify for benefits, you have to meet the contribution requirements through one of the three pathways that you see on your screen. So we have the permanent pathway. This will earn someone the full benefit amount by contributing for at least 10 years at any point in their career. Then we have the temporary pathway, which earns someone the full benefit amount if they have contributed for at least 3 of the last 6 years at the time that they apply for benefits. And then we have the transition pathway, which earns someone lifetime access to 10% of the full benefit amount for each year that they contribute. The transition pathway is specifically for folks who were born before 1968. These workers can also earn access to the full benefit amount if they qualify through one of the other pathways. So, for example, someone maybe who was born before 1968, right, and maybe close to retirement potentially, if they retire but then decide to take a part-time job, right, and they're working at least 500 hours per calendar year, then they would continue to contribute and then therefore could earn access to, again, one of the other two pathways. So as another example of what the benefit amount looks like for someone in the transition pathway, if someone works and contributes for 500 hours a year for 2 years, then they would earn 20% of the full benefit amount, which comes out to just about $7,300. So this is what contributions look like over the course of someone's career, right? We have 3 examples there. I'm just going to focus in on the middle column there. So someone who earns about $59,000 a year is contributing $29 each month, and that adds up to just over $10,000 over a 30-year career. And so in order for someone to earn less in benefits than they contribute, they would have to make an average of $210,000 each year, and that's over 30 years, right? And we see at the bottom there, the benefit amount is starting at $36,500, which again will grow over time with inflation. So to use your benefits, we must determine that you need help with 3 or more activities of daily living, and will also continue to need help for at least 90 days. So the activities that we assess are bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. And if an applicant requires supervision with an activity of daily living due to cognitive limitations, so monitoring, queuing, or setup assistance, that counts as needing support with that activity of daily living. And that way, our eligibility process captures not only people with functional limitations, but also those with cognitive limitations. Later on in the presentation, the assessment team will also be providing some more specific information about each one of these ADLs, or activities of daily living. So when you're ready to apply for benefits, you'll start by creating an online account. You can also have someone else help you manage your account. And we also partner closely with the area agencies on aging, and they will be available to for more support and help you maybe as well if you have maybe an in-person or need support in person, they will also be able to support. So once you submit your application, we'll confirm that you've met the contribution requirement, and then you'll be able to schedule an appointment to talk about your care needs. So after we meet with you, then we'll let you know if you're approved to start using your benefits. And then once you've been approved, you can start using your benefits to receive any covered services and supports from a WalkCares provider. So what you see on the screen there is a list of our covered services and supports. So you may, for example, want to choose services to help you stay in your own home. That can be in-home care, home modifications, home delivered meals, or adaptive equipment and technology. We also cover many services that support family caregivers, so you can get paid care from a loved one, including your spouse, or you can get respite care so that they can also take a break. We also cover education and consultation to help manage your care, dementia and behavioral supports, and care transition coordination to support you when you leave a facility like a hospital. You can also choose to receive services in your community, so things like an adult family home or adult day services, or you can choose to receive care in an assisted living facility or nursing home, including memory care. So you might be wondering how far your benefit amount will go. For about a third of people need care for a year or less. And for those people, depending on the services that they choose, WalkCares may be able to cover all or most of the care that they need. For others, WalkCares can provide your family with some immediate relief and also time to plan for future care costs. So here are some examples of how someone could use their benefit. So if you'd like to pay a family member for care, you can receive care for 10 hours per week for 2 years and get care supplies for under $35,000. Or if you want to make your home more accessible to keep living there independently, you can make home modifications, install a personal emergency response system, and get meals delivered for 3 years for just over $36,000. And if you need short-term help after an accident, maybe you could get in-home care for 20 hours per week for 6 months, install a ramp, and buy safety equipment for less than $29,000. So benefits will become available statewide in July 1st of next year, but we wanted to share some other key dates to be aware of before then. So we will be piloting our entire system in Lewis, Mason, Thurston, and Spokane counties with a limited number of applicants. Residents of those counties can begin their application starting on January 6th. On April 1st, you'll be able to create an online account, which you can use to check your annual contribution statements, and that will be also where you eventually will apply for benefits. Then on May 18th, applications for benefits will open statewide, and on July 1st, all beneficiaries can start receiving services. And also starting in July of 2026, next year, you can choose to continue participating in WalkCares if you leave the state. So to become an out-of-state participant, you must have contributed for at least 3 years, for at least 500 hours or more per year. And then you must opt in within a year of leaving Washington. So just like other workers, out-of-state participants will keep contributing to the fund during their working years. And the process for reporting and paying premiums for out-of-state participants is still being worked on, but the focus is on making it as easy as possible. And then starting in July of 2030, out-of-state participants will be able to access their benefits outside of Washington. So that concludes our Walk Cares program overview, and then I'm going to pass it over to Maria to jump into the assessment process.
Thank you so much, Sebastian. It's taking a minute, I think, for my video to load. Can you hear me?
Yeah, I can hear you.
Thank you. Oh, okay. I want to try one more time for my video. So sorry, everyone. Okay. There we go. Thank you, Sebastian. The purpose of our assessment is to evaluate a person's long-term care needs to determine if they meet eligibility requirements, which is to undergo a care needs assessment in order to determine assistance with at least 3 activities of daily living for at least 90 days. An assessment identifies whether there is a functional dependence or if a cognitive decline has occurred. The intention of gathering information during an assessment is to fully understand and evaluate a person's functional and cognitive status. Assessments also are the primary source of information to develop service suggestions. At WalkCares, we call these suggested services. Suggested services are particularly important because many of us don't know where to start with long-term care. With WalkCares, there are 19 covered services. The care needs assessment can identify a person's care needs, determine functional eligibility, and develop suggested services based on the information gathered at the time of the assessment. Gathering a more detailed health history will help us understand a beneficiary's long-term care needs and be able to provide service suggestions based on the information gathered during the assessment. Next, we will go over activities of daily living. Activities of daily living, also known as ADLs, are related to personal care, such as bathing or showering, getting in and out of a bed or chair, and eating, using the toilet. There are 7 activities of daily living for walk carers. They are mobility, bed mobility, transferring, eating, medication management, toileting, and bathing. I will provide some short examples for each activity. An example of assistance with mobility could include assisting a person walking from room to room, or helping them to walk outside, helping someone with the use of assisted equipment, such as if a person uses a walker in their living environment, but they may need more help when they're out in the community. A person may become fatigued and short of breath when they're walking for longer distance while out in the community and require assistance, such as walking next to them, such as someone walking next to them, or even pushing them in a wheelchair. Assistance with bed mobility could be helping someone reposition from lying down or side to side. Transferring could include assisting someone move from a bed or chair or from a wheelchair to a standing position. Assistance with eating can include sitting next to someone if they are at risk of choking, or physically assisting them with their food or drink intake, whether by mouth or through a feeding tube. Like placing food on a fork or a spoon, getting the food from the plate to their mouth, or assisting to open containers or packets. An example of assistance with medication management can include helping someone take their medication such as placing the medication in the person's hand or prompting them to take their medication, like reminding them to take their medicated eye drops. Supplements and over-the-counter medicine are also included. An example of toileting could include assisting someone use the toilet or a bedpan or commode, assisting someone to get on and off the toilet, helping to cleanse or helping to change any pads, or assisting with a catheter or ostomy. It could also include helping someone unzip or unbutton their clothes so they could use the toilet. An example of assistant bathing could be assisting a person get in and out of a tub or shower, helping a person wash part of their body or all of their body, or reminders to bathe or shower, putting in a shower chair or bench so the person can wash their own body. And at Walk Cares, we also understand that not only functional limitations can affect a person's activities of daily living, but also cognitive limitations. Cognitive impairment can affect if someone completes an activity of daily living and how they complete it. The care need requirement was developed to ensure individuals who need assistance due to cognitive impairment, such as needing supervision, cueing, or reminders. Next, we will go over the 90-day determination of need. As part of the care need requirement, a person's need for assistance with 3 activities of daily living must last at least 90 days. The 90-day determination of need was recommended and adopted into the RCW to make sure benefits are preserved for longer-term care needs, whether it's during working years, aging-related, or disability-related. To determine if a person's assistance with 3 activities of daily living may last at least 90 days, staff will consider the following 5 factors. Diagnosis of a chronic condition or prognosis of a condition impacting activities of daily living that is likely to last longer than 90 days. Terminal illness, hospice, or palliative care. Home-based assistance received from family, friends, or paid providers within the last month. Care in a residential setting. Or recent history of falls resulting in serious injury or hospitalization. If staff are unable to determine the 90-day determination of need using the 5 factors, then there is a 90-day certification form where staff or applicants may submit to the person's healthcare provider to certify if the person's need for assistance with activities of daily living is expected to last 90 days or longer. Next, I will pass it to Sun Young, who will go over how assessments are conducted.
Thank you, Maria. Now that we have talked about determining whether a person's care needs are expected to continue for at least 90 days, let's take a look at how assessment is conducted. Assessment will be conducted in person, either in your home or in a community setting you prefer, so such as a senior center or another comfortable private location. The assessment will be conducted by a WACARES team member from the Department of Social and Health Services or by staff from your local area agency on aging. Each assessment may take up to 90 minutes to complete, giving assessor enough time to review daily activities, supports, and other needs. In-person assessments are the standard method since they allow assessor to observe your environment and have more personal interaction, which helps ensure the most accurate understanding of your needs. In some situations, a remote assessment may be offered. The remote assessment option is not based on participant choice. It is available only when certain criteria are met. For example, when the individual is receiving hospice care services or residing in a residential facility and has an active plan of care for long-term services and supports. Just like in-person assessment, remote assessments take about the same amount of time, up to 90 minutes, and follow the same structured process to ensure accuracy and consistency. So in summary, while we do offer both format, most assessments will be in person to ensure accuracy and personal connection. Next, Jesse will walk us through how assessments are scheduled and what you can do to prepare ahead of time. Thank you.
Thank you, Sung Young. I'm going to talk about scheduling your assessment. After an approved contribution determination is received by WellCares, an individual application is automatically created in BCC console. Applicants are notified in their WellCares account to provide their scheduling preference for completing the intake call. The intake call is utilized to schedule assessment for the applicant and answer any questions the applicant has about WellCares and provide information on what to expect during the assessment. Intake calls will also confirm address for regional assignment, preferred language or accessibility accommodations, and setting up the appointment date and time preference. Intake calls will also inquire about any support needed by the applicant during the assessment and encourage that if needed. Let's go to the next slide, please. I'm going to talk a little bit about preparing for your assessment. Once the intake call is completed, your care needs assessment will be scheduled in the BCC console. You will receive a message from BCC console with scheduled date and time and name of assessor. This will be for you to verify the information is correct. If you are performing a remote assessment via Zoom, you'll want to confirm your technology is ready for the virtual assessment. The remote assessment will give you specific information with Zoom meeting ID and password. Prior to your assessment, the applicant will need to be prepared that the assessment will take approximately 90 minutes to perform. The assessor will review the required forms, discuss health information, and ask questions about areas you may need help with in daily living activities. If you have any supporting documents that are current or in the past month, please have available for assessor to review at the time of assessment. Supporting documents can be a current care plan from a home care agency or discharge paperwork from nursing home or hospital that supports care needs, and if those care needs will likely last 90 days. But I do want to emphasize these are not required documents, and this should not delay your assessment if you're unable to obtain prior to the assessment date. Next, I'll pass it on to Tina.
All right. I will be talking about what to expect during the assessment. A trained assessor will meet with you in your environment, for in-person or remotely virtually. Assessor will review the assessment process with you. In addition, during the assessment will ask questions regarding your healthcare needs and your ability to complete activities of daily living. As previously mentioned, they are bathing, transferring, mobility, medication management, toileting, bed mobility, and eating. Assessor will use your answers and the assessment tool to determine whether you meet the care needs requirement. In addition, if more information is needed to determine functional eligibility, our assessor may ask for your permission to speak with your family member or your support system. If a functional eligibility can be determined at the assessor will review the suggested service with you. And next, I'd like to invite Terry to review what to expect after the assessment.
Thank you, Tina. And As you can see here, this section will talk about the benefit determination letter. To the left, if you're eligible, the letter includes suggested services and supports based on your assessment. And we've talked pretty thoroughly about what it means with regards to the suggested services. You can choose any service you want. You don't have to take the suggestions and actually start using the benefits. And then to the right column, if you're not eligible, you can request an appeal using the information in the letter. If your health or care needs change, you can reapply. And with that, I will turn it over to Sam for questions.
Thanks, Jesse. Um, yeah, so if you have any questions, feel free to add them into the chat and I will go through and answer them. So the first question, I'm not sure which one of you would be best to answer this, but is there a look back period for ADLs?
Day look back period for activities of daily living. Oh, I think I just froze. So sorry.
Oh, you're okay. Go ahead.
Yes.
We did. It got cut off. Sorry.
Oh,
We
we
couldn't
got cut
hear
off.
you.
No
Yeah.
worries. I'm so sorry about that. The look back for activities of daily living is a 7-day look back period.
Perfect.
Minus
And
for
then,
medication management. So sorry. That is the one activity of daily living that does not have a look back period.
and then how long is the application process expected to take?
I think that's a good question. So it's the application will start off with getting first to ESD for the contribution requirement. And then once ESD makes their determination whether a person has met the contribution requirement, both the individual, the applicant, and DSHS will be notified. And that can take anywhere from 1 to 2 days, up to, I believe, maybe 14 days, in case there is needed for some additional checking. And so I believe that first period could be 14 days. But we will do our best to be able to get you a schedule assessment and a determination within 45 days of that contribution requirement.
Thank you. And Sebastian, if somebody uses part of their benefit, does the remaining balance increase with inflation?
Yes. So, yeah, whatever remaining balance someone uses after being approved, then that will increase with inflation. If someone needs has a care need after a year of using sort of their initial part of their balance, then there will be another care needs assessment will be required, but that remaining amount will increase with inflation each year. Yeah.
Will WACARES reach out to the beneficiaries' medical professionals to obtain medical records?
I can answer this. Only if the assessor is not able to obtain information or medical history or medical information from the applicant or the family member.
Is there a minimum time period someone needs to wait to reapply after being denied?
I can answer to that question. So the answer is a no. So there is no require waiting period to reapply after denial. So if the individual experience a significant change in their functional limitation, they may submit a new application at any time, as long as a contribution determination is available. Yeah, hope that answered.
Perfect. Will the assessment process vary by the type of services being applied, or do the assessors not know what type of services are being sought after?
Can you read the question again, Sam? Sorry.
Yeah, no problem. Will the assessment process vary by the type of services that someone is applying for?
No, the assessment process is the same regardless of the type of services the person needs.
I can add to a little bit about this. So based on the information collected during the assessment, the system, the Get Care system, that's the tool we are going to use to complete the assessment. So based on the information we collected during the assessment, the system will generate suggest services. So the assessment will be the same, but based on the information, the suggest services will be generated for your consideration. So at the end of the assessment, our assessment specialist will go over those system generated suggest services with you for your consideration.
Perfect. Sebastian, how often does the benefit adjust with inflation?
So it's yearly. So the benefit is adjusted yearly or each year for inflation.
Um, if I haven't paid into the contribution requirement, if I haven't met the contribution requirement before becoming disabled, will I not be eligible?
Um,
Sebastian.
yeah, so in order to become eligible, you have to meet the one of the three pathways in the contribution requirement, and then also, as we talked about, the care needs requirement. So if you meet one of those three pathways, then that would be you would meet the contribution requirement, and then would have to schedule a care needs assessment to see if you meet the care needs requirement as well.
If you work in Washington, Sebastian, this one's for you also. If you work in Washington, is the contribution a requirement, or do you have to sign up for the deduction?
Yeah, so almost all Washington workers contribute to the Walk Cares Fund. There are some exceptions, like federal workers, for example, or employees of tribes are also exempt, right, from the program. But if you work for a Washington employer, then you are automatically, right, and contributing to the program. And again, there's some other groups, like if you're self-employed, for example, those folks have to opt in order to start contributing to the program. But again, if you are an employee of a Washington-based business, then you are contributing to the fund.
Thank you. This question is, how can you calculate the inflation increases? Is there an example of this? I can take that one. We do have a calculator on our website where you can plug in all of your information and your annual earnings, your contribution, your birth year, and it'll tell you how much it'll estimate your benefit amount, depending on what year you plan to use it. And that is on our How It Works page on our website. If an assessment takes 45 days and a family has been privately paying for services, will they reimburse can you be reimbursed? Does anybody want to take that? It's okay if you don't. Um, there will be a reimbursement process, but only for specific services that will be available. It will not be available during our pilot program, but during statewide launch, there is a reimbursement process, and we'll have more information for that available on our website as we get closer to benefits launch. There's a few questions about the slides. The slides are already available on our website. You can go download them right now on wahcaresfund.wa.gov/webinars. Um, sorry, some of these are long. Um, can you use your benefit pay to pay your provider directly? Sebastian.
Yeah, I can take that one. So yeah, the benefit will be used to pay the provider directly, but WalkCare's team will be the WalkCare's fund will be the one paying those providers directly, so that you won't have to do that, right? The beneficiary won't have to do that on their end. So the beneficiary will choose which services and supports that they would like to receive based off of course, their care needs, and then we will be the ones paying those providers directly.
Will there be a way to access your benefit if you don't have online access?
Yeah, so if you are unable to fill out an application online, we again are working with the area agencies on aging throughout the state, which have physical offices across the state, and they will be able to assist with in-person applications if that's what you would prefer. Yeah.
Um, this question, maybe Sebastian, how are you choosing the pilot participants if they haven't had enough time to contribute to the program?
Yeah, so that's a good question. So the contributions began in July of 2023. We are primarily looking at folks who might qualify through the transition and the temporary pathway, right? Folks who maybe have contributed 3 of the last 6 years, or folks who may be near retirement and can earn, again, 10% of for each year that they have contributed. So really, those are the two pathways that will be available for pilot, and we're looking to, of course, identify folks within those pathways. The third pathway being folks who have contributed for at least 10 years. So obviously that pathway will be available later on when the program is available statewide for folks.
I'm going to read a few questions that were on the registration form. So if you submitted a question through your registration, I'm going to read those right now. Will the assessment be in home? And do you have to redo your assessment annually?
I can take that. The assessment, as we mentioned earlier, will be in your environment, either at your home or a location of your choice. And there's no requirement to do an annual assessment.
If you disagree with something that your assessor marked during your assessment, are you able to appeal?
I can take this one too. If you at the end of the assessment, the assessor will review the assessment outcome or the coding with you, and you have the option to have that discussion then. If not, you do have the option to appeal afterward. And when you get your benefit determination notification, there will be instruction how to follow that process.
Sebastian, in 2026, can anybody apply for benefits or is it just the select people in your pilot program?
Yeah, so starting July 1st of 2026 is when folks will be able to apply statewide. So again, anyone across the state. The pilot program, again, specifically for Lewis, Mason, Thurston, and Spokane counties, will begin on will be from folks can apply for the pilot between January 6th and February 28th.
How long will the assessment take?
I can answer to the question. So it will take up to 90 minutes. Depends on how it goes, but it could be quick, but we are thinking that it will take up to 90 minutes. And then for those individual who needs translator interpretation, during the intake process, that you guys can let us know if you need interpretation services, then we'll provide that as well. So the assessment itself, both in person and remote assessment, it will take up to 90 minutes.
Um, Sebastian, how do I check how many years I have contributed to the program and when did my contributions start?
Yeah, so contributions started in July 1st of 2023. And then in April of next year, when you folks will be able to start creating their online accounts. At that same time, you'll be able to see what your contributions have looked or are up until that point. So again, April of next year, when you can create your online account, you'll also be able to see your contribution, how much you've contributed so far to the Walk Cares Fund.
Tina, are assessors medical professionals like RNs or LPNs, or will it vary?
They are not. They are not medical professional.
Um, if How will a beneficiary receive services if they only need short-term help with ADLs, like for 4 to 6 weeks after surgery? Will that qualify them?
I could take this one. Unfortunately, it will not, if they do not meet the 90-day determination need requirement. So you do have to need, an individual will need assistance with 3 activities of daily living that is ongoing for 90 days. So if you do not meet the three ADLs, you may be denied of the benefit. If you do not meet the 90-day need requirement, you may also be denied of the benefit.
Tina, approximately how many questions are expected to be asked during the assessment, and will we know what the questions are beforehand?
That's a good question. I don't know how many questions total, but there'll be section on the ADLs that was mentioned earlier: bathing, transferring mobility, medication management, toileting, bed mobility, and eating. In additional, there will be question about the cognitive evaluation, mini cognitive evaluation. We might also confirm like your identification, meaning your birth date, your residential address. So if I have to give you a number, I don't know that total number, but the focus will be around ADLs and your health history.
I also think it's important to add that there may be, not, it will be the same. It'll be the same structure and layout, but based on what each beneficiary is showing and sharing, they may have additional follow-up questions and different things. So it's not like a strict question and answer process as well. Right? Tina, correct me if I'm wrong.
That is correct.
Sebastian, if somebody has long-term care, private long-term care insurance, Is there a rule that walkers or the private insurance needs to be used first?
No, so if someone has a private long-term care insurance and then also is eligible to receive the walk cares benefit, they can choose how to use and when to use the benefit, but we'll have that benefit available. We don't recommend or don't can't recommend and really suggest contacting your healthcare broker or who sold you the policies to determine the best option. But once you are eligible, you will be able to use that benefit amount for the supports and services.
Um, Tina, since the assessors are not medical professionals, are team members specifically trained for WACARE's assessments, or have they been doing this previously for other programs like Medicaid or Jesse? One of you.
I can answer, Sam. They'll be trained. They're not necessarily going to be medical professionals, but they'll be individuals that either have experience in social services or other have utilized other assessment tools in the past.
Is the assessment conducted with a specific tool, or will assessors be writing it down on paper?
They'll
I could
be you go ahead, Sonia or Tina, go ahead.
go ahead. Sorry, didn't mean to interrupt you.
They'll be utilizing the Get Care tool, and they'll be utilizing it via computer, other laptop at the home or place of where they're performing the assessment.
Perfect. And then somebody is saying, will there be a sample assessment that we'll be able to see, or are we able to get the questions ahead of time? How can we prepare for our assessment?
Ooh, we have not thought about that. As of right now, there is no sample. I'm not no not yet anyway, and we are not going to send the assessment question ahead of time. But our assessor will be trained to really go through the questions with you to ensure full understanding of the questions.
I think that's it for questions for right now. If we were unable to answer your question that you submitted, please contact us through email or by phone. I'll put the link in chat and we will get back to you or answer your question on the phone. Um, Next slide, Sebastian. As soon as you close out of today's webinar, a survey will pop up on your screen. And if you could take a few minutes to take a short survey about your thoughts on today's presentation, that would be helpful. Help us improve webinars in the future. Next slide. Again, you can find our webinar materials at wacaresfund.wa.gov/webinars. The slides are already available, and the recording of today's presentation will be available within 24 hours. You can follow us on social media, Facebook, Instagram, and LinkedIn. And again, our phone number is right here, 844-CARE4WA is our general question line. And if you have specific questions about exemptions, you can call the 833 number, or you can contact us via email. Thank you all for joining us today, and we hope to see you on a webinar soon in the future. Thank you.